Steps to perform CPR. Step 1. Remove all the dangers. Step 2. Call 999. Step 3. Make sure the person is lying on his back on a firm surface. Kneel beside him and place the heel of your hands on the center of the chest. Keeping your arms straight, cover the first hand with the heel of the other hand and interlock the fingers of both hands together. Keep your fingers raised so that they do not touch the person's chest or ribcage. Step 5. Lean forward so that your shoulders are directly above the patient's chest and press down on the chest about 2 inches. Release the pressure but not your hands and let the chest come back up. Repeat to give 30 compression at 100 compressions per minute. Then, move the person's head. Tilt his head and lift his chin to open the airway. Let his mouth fall open slightly. Pinch the nostril close with the hand and that was on the forehead and support the patient's chin with your other hand. Take a normal breath, put your mouth over the patient and blow until you can see the chest rise. Repeat the cycle of 30 compression followed by 2 rescue breaths until either the person's conscious or until the medical team arrives. Thank you. Choking. Choking is caused by 2 factors: when the airway is partially blocked or when the airway is fully blocked. In order to identify whether the passage is fully blocked or partially blocked, we need to ask the victim whether they're choking or not. If let's say if they are if their airway is mildly blocked, the person will be able to speak, cry, cough, or breathe. They'll be able to clear the blockage themselves. We just need to encourage them to keep coughing or try to clear the blockage. We need to ask them to try to spit out the object if it is in their mouth. We should not put our fingers into the mouth to help them as they might bite accidentally. And if let's say if the choking is severe, first we need to call 999. Second, we need to perform some procedures in order to remove the blockage. First, we need to stand behind the person and wrap our arm around the wrist. Second, place your clenched fist just above the person's navel. Grab your fist with the other hand. Quickly pull inwards and upward as if trying to lift the person up. Perform a total of 5 abdominal thrusts. If the blockage is still dislodged, continue 5 cycles on the back, 5 cycles of back blow and 5 abdominal thrusts until the object is coughed up or the person starts to breathe or cough. Take the object out of its mouth only if you can see it. If let's say the person is obese or pregnant, we need to stand behind the person, wrap our arm around them and position our hand at the base of the breastbone. We need to quickly pull inwards and upwards. We need to continue this step until the object is dislodged. We need to perform CPR if it's necessary. If let's say if you're trying to remove the blockage and then the victim may fall unconscious, we need to perform CPR immediately. If the victim is an infant, hold the baby face down along your thigh with their heads lower at their bottom. Hit them firmly on the back between the shoulder blades up to 5 times. If the back block does not dislodge the blockage, we need to turn the baby over so that they are facing upward. Place 2 fingers in the middle of their chest just below the nipple. Push sharply inwards and up to 5 times. Call 999 if the blockage is not dislodged. Thank you.